Hi, I'm Dave Schenkel. I'm a sports chiropractor here at the Proactive Athlete in Burlington. We got Sean McBride here to help us out with this segment. Today we're going to talk about how we assess and treat for limited or restricted mobility in the ankle. Specifically, we're talking about dorsiflexion in this segment. So just get Sean to show basically in an open kinetic chain movement what dorsiflexion is. Basically bring your foot all the way up towards you, and then plantar flexion would be the opposite. So some of the common reasons why we might have restricted ankle dorsiflexion would be restriction from the ankle mortise joint itself, or the joints surrounding the ankle, or soft tissue up the backside of the calf, or the posterior kinetic chain continuing into the foot. The manifestations of what restricted dorsiflexion might do to an athlete are restricting their performance, restricting their ability to generate power from the posterior kinetic chain muscles such as the calves or the glutes, and also from an injury prevention perspective. A recent study in the American Journal of Sports Medicine on elite junior basketball players demonstrated that those athletes that were followed throughout a year that had a restricted ankle dorsiflexion at the beginning of the season had a significantly higher risk of sustaining patellar tendinopathy, or jumper's knee, what's more commonly called. So to assess the ankle, we're going to use something that's called the lunge test in the literature. Some people call it the knee to wall test. We're going to use an inclinometer to measure the range of motion. You could also use a goniometer. Some people for this test measure the distance from the toe to the wall, but it's more valid if you actually measure the range of movement from the tibia relative to the ankle mortise joint. So what we do is take the inclinometer and place it approximately 10 centimeters below the tibial tuberosity on a nice flat point on the tibia. And we'll ask Sean to bend as far forward as he can through the ankle. And I've left the inclinometer facing you, but we've already done this with Sean once. What Sean wants to do with this test is move as far away as he can from the wall without his heel coming off. In the literature, basically a restricted value is anything under 35 to 38 degrees would be restricted, something we'd want to treat. Sean definitely doesn't demonstrate that for us here today, so we wouldn't need to necessarily do some of the treatment methods that we're going to go through. But there are lots of athletes that are restricted under that 35-degree range. And in fact, in the American Journal of Sports Medicine study that I talked about earlier, they used a cutoff point of 36.5 degrees as the point at which the athletes are at much higher risk for sustaining jumper's knee. So using the lunge test or the knee to wall test, if we've identified that the athlete or the patient might need some mobility treatment for the ankle mortise joint, we can do something called a posterior talus glide. Very simple, open kinetic starting point for this movement. Grasping the patient's calcaneus and using my top hand basically to block the talus or help move it in a posterior direction, I can help mobilize the joint into dorsiflexion. If it's a patient with chronic recurrent ankle sprains, there may be a positional fault in the fibula, in which case you may want to take part of your palm to part of the hand to put a posterior force on the fibula while mobilizing in dorsiflexion as well. So to get Sean in more of a weight-bearing functional position, we have him standing in a lunge on the treatment table. He's using the wall to support himself for balance. This isn't a balance test. We have this belt to give me some leverage to help glide the tibia into dorsiflexion, and specifically in this first position to help glide the tibia anteriorly relative to the talus. So I'll get Sean basically to go into a lunge forward, which is essentially functional dorsiflexion, while I am trapping his talus. And we'll go through that in a bunch of different ranges. And first we got Sean going straight forward. I also want Sean to now bring his knee out on an angle. We want to stress this in a bunch of different planes, basically to challenge a wide spectrum of the ankle joint itself. Okay, and now back to this side, Sean. And keep going. We can also use the belt a little higher up on the tibia itself to help with dorsiflexion again. Keep going. So this will help give us direct results in a weight-bearing functional position. We've Sean basically position his foot on the treatment table so that we can use this drop piece. Again, using a contact on the talus itself, it's going to be a quick, high velocity, low amplitude force through the ankle mortise joint. Looks something like that. Same as we were doing for the mobilization with movement, we want to try and stress or try and direct the forces through the talus in various planes. So when treating soft tissue of the backside of the calf, we basically have 3 levels of soft tissue in the calf that we're concerned about. We have the gastrocnemius, which is a 2-joint muscle crossing the knee and the ankle. So when treating that, we have to take them through a full range of knee extension and ankle dorsiflexion. Deep to the gastrocs, we have the soleus, which is only a 1-joint muscle crossing the ankle itself. And then deep to the soleus, we have some deep flexors, tibialis posterior, flexor digitorum, and flexor hallucis. Each of those muscle layers will dictate different muscle movements, either a combination of knee extension or dorsiflexion through the ankle with a myofascial contact through each. So we've talked about the assessment and some of the treatment strategies we'd use here in our office to treat restricted ankle dorsiflexion. It's really important that this does get assessed in a functional examination. For injury prevention, we talked about problems that can occur up the kinetic chain, such as the knee, and also from a power generation. So really important that athletes and active people overall get their ankle assessed for this mobility in their ankle. Until next time, be proactive.